Are you all seeing the
Okay,
full screen
yes,
thing?
yes,
Cool.
we all have it. Good. Always the best laid plans, always there's always something we need to be flexible about with technology. So we really thank everyone for your patience and we will get started. Okay, so we're going to start with this is our 2024 renewal webinar. And as you heard, we're getting, sorry, okay, Dr. Chatanga's in the waiting room if someone can let her in. We'll start out with introductions, which we already have done. I'll talk about the role of the board, the 2024 process. I'm going to turn that over to Dr. Chatanga, who, as you heard, is our executive director, and will be updating us on some of the recent changes to the renewal cadence, which we think will be helpful for you all this year. Next slide. Okay, so we were able to do some introductions. As mentioned, I'm the chair of the board, and the huge lift of the work of the Board of Medicine is done by Dr. Chitanga, who is our executive director. And we have two lawyers who work for the board, our counsels to the board, attorney Suzanne Fensel and attorney AJ Gohill, who help with a lion's share of the work as well, in addition to our very capable staff of health licensing specialists who really get the day-to-day work of the board done. They're very, very hardworking staff. Next slide, please. We just like to remind everyone that the mission of the District of Columbia Department of Health is to promote health, wellness, and equity across the district and to protect the safety of the residents, visitors, and those doing business in our nation's capital. And this is the mission with which the volunteers, the volunteer physicians and volunteer public members on the board approach our work. We want to license a capable workforce that is going to help DC Health carry out its mission. And so we always keep the protection of the public in mind when we are licensing and reviewing current licensees before the board. Next slide, please. The mission of the Division of Health Regulations and Licensing Administrations, or HRLA, which we call it, is to protect the health, as mentioned, of the residents of the district, those doing business by fostering excellence in health professional practice, building quality and safety in health systems and facilities through an effective regulatory framework. Next slide, please. Here's the organizational structure. As you can see, we several divisions and departments that come under the DC Health, of which you see our Office of Health Professional Licensing Board is there in the middle. Next slide, please. So the role of the DC Board of Medicine. Next slide. As mentioned, a repeat of the mission statement that's here. And again, a big thing that we do is really try to promote evidence-based practices in health regulations and employ a very high standard of quality care and implementing policies that prevent adverse effects. So when we talk about the amount of CME that's needed for licensees, when we decide, who should get a license within the district, we're really looking to promote evidence-based best practices for the residents of the district. Next slide. So as you all may know, and we generally go over this each webinar, just so you recall, the board licensure system in the United States consists of volunteer appointees that are appointed either by the governor of their state or by the mayor in our case, or by MOTA, the Mayor's Office of Talent and Appointments, that appoints people to serve on any actually health board, not just the Board of Medicine. That would include a Board of Dentistry, veterinary, et cetera, et cetera. But here we're talking about the Board of Medicine. And so there is no unified federal system, like there's no federal medical board, right? Each state is able to govern the medical practices within that state. We work and receive guidance from the national regulatory body, such as the Federation of State Medical Boards, which it was mentioned in the beginning that I serve on the board of directors of. That's also consisted of representative from various state boards. And we're so happy to partner with local associations such as MSDC, like we're doing tonight. Next slide, please. So the board is composed of 15 mayoral appointees. 10 members must be licensed physicians in the District of Columbia, and they must reside in the District of Columbia. 4 are to be consumer members, or we call those public members, so that they can give the perspective of the public when we're making our decisions. And 1 member must be the director of the Department of Health or his or her designee. So that's who is constituting the Board of Medicine and making decisions regarding policy and disciplinary matters. Next slide, please. We've listed the responsibilities of the board here. And just for your recall, to establish the scope of medicine or scope of practice or title protection, to set standards and determine continuing competence. So like CME would be a example of this. Also determining which fellowships are able to be conducted in the district, who can be a resident to train in the district, a lot of aspects of the work of the Board of Medicine. We oversee initial license and renewals, which is what we're going to be talking about tonight. We investigate and resolve complaints, and this is something that people tend to think about when they think about a Board of Medicine, but we definitely do so much more. Including conducting competence and capacity proceedings. And again, we want to inform and remain accountable to the public, owing to our mission of protection of the public. So our goal here is to distribute public information and to support licensees in their ability to care for the residents of the district. Next. Just an example of the amount of licensees that the board licenses. And I love that I see some people leaning in to look at these numbers. You know, a lot of times you think, oh, it's just the docs, right? No, we license a large swath of licensed professionals within the district. I can direct your eye to the bottom. You see it's close to 17,000 433, oh, it is 17,433 licensees. And there's a wide variety of licensees that you see there. Now, definitely the physicians make up the largest component. You see there close to 13,000 physicians are licensed by the Board of Medicine. However, physician assistants make up a large component, and the residents, all of those areas where it says medical training license A, B, registrant, those are all the learners. The residents that are rotating, any fellows that don't have full licenses, people coming in for like a 2-month rotation, you know, those kind of people. So you see, it's a pretty big number there, right? So we're busy on the Board of Medicine making sure that we're getting that information out to you. Next, please. And then here's just that list written out a little bit here. And we do have some upcoming changes, which I think Dr. Shatanga may mention, because we recently restructured our Practice Act, and some of the previous roles of the Board of Medicine or the previous licensure groups that I just showed you will be incorporated into a new board that I believe Dr. Shatanga might mention later. But this is just, again, a example of the various categories of licensees that the board regulates. Next slide, please. Licensure overview. So here are the components. You know, we ask these questions: has the licensee graduated or has the applicant graduated from an accredited school, right? So that's why people have to, you know, provide transcripts and documentation that they've graduated from their training school. Have they passed the required examinations? In the example of physicians, we want to know if they've passed the USMLE, United States Medical Licensing Examination. I always point out the L is for licensure. It's a licensing examination, so we want to make sure that you've passed the licensure examination to be licensed in the United States. Or if you're a DO, doctor, osteopathic physician, you've passed the COMLEX, which is the equivalent for DOs. And we also look at things like experience. You know, have you done your residency? Have you completed training and all applicable necessary clinical experiences? Next slide, please. We ask screening questions, as you know, clean hands, screening questions, making sure everybody's paid all their debts to the city, to the district, I should say, criminal background check that has been reviewed by our legal staff. Has the licensee or the applicant provided proof of licensure in good standing from another jurisdiction if the licensee is licensed in other jurisdictions or other states or areas? And currently required by 6 professions, has the applicant passed the jurisprudence examination, if applicable? Next, please. Okay, so here is the exciting part that you all have been waiting for. What is different in 2024? Well, there's a lot that's different, but it's going to be better. Good changes, good changes. So I'm going to change it over or pass it over to my boss, Dr. Shatanga, who is going to get down to the details. So passing it over to you.
Good evening, everyone. I apologize for the technical glitches before we started. Um, I do, before I get into the renewals, just want to address something Dr. Anderson made, a statement regarding the Medical Practice Act updates. So that is changing our board composition. We're now having physician assistants on our board. We have a number of vacancies, both for physicians and physician's assistant. We'll share the details after the webinar. If you or you know someone who would be interested in joining our board. We also have a new board of integrative healthcare that will deal with chiropractors, acupuncturists, naturopaths, and there's also a space for physicians who operate in holistic medicine or integrative medicine. So there's several vacancies that we are trying to fill, and we're very interested in receiving applications for that. But back to the renewal process. Next slide, please. As with the previous renewal, everything is exclusively online. We are currently live for all application types as of October the 1st. I've stated the link in the chat, but we'll also provide it with the materials after this uh, webinar. The biggest change is that previously we worked on biannual renewals, and it's always worked like this since the beginning. However, in response to feedback from the health professions, we've changed the renewal system to align with licensees' birth month as well as their birth year. So instead of an expiration date for 2 years from now in 2026 on December 31st, licensees will now receive uh, expiration dates based on their month of birth as well as their birth year. So individuals with odd numbered birth years will receive odd number expiration dates versus individual with even number birth years will receive um, even numbered expiration dates. What will be different instead of December 31st expiration date is that you will receive an expiration date on the last day of your birth month. So this is applying to all licenses, registrations, and certifications that the district issues. And this is has been put in place to streamline the process. So instead, and everyone will not be renewing in bulk now. It'll kind of smoothen the number of renewals over a year, and this will lead to greater efficiencies. Next slide, please. So as Dr. Anderson mentioned, the major components of the renewal this year are the demographic information. Some of it will auto-populate, so you don't have to fill everything from scratch again. Our screening questions are the same. They've just been updated to make it easier for you to submit your documents. Clean hands, as Dr. Anderson mentioned, hasn't changed. Our continuing education requirements also have not changed this year. We do have some updates to the workforce survey, but we are still requesting a CBC, a criminal background check for every application filed in the district. You do not need a vaccination attestation at this point in time. That's been removed. We do require PDMP registration. That's the Prescription Drug Monitoring Program. So you will not be able to renew your license if you have not registered for the Prescription Drug Monitoring Program. If you have you have not sort of attested to the clean hands questions, or if you have had you've answered in the affirmative to any of the screening questions, our licensing specialist will reach out to you at the earliest opportunity. So I encourage everyone to start the process as soon as possible if you and if especially if you answered in the affirmative to any of our screening questions. And lastly, the fee for our renewals this year, the fee remains the same. It's $500. After December 31st, we do have a late renewal period that ends on the last day of January, and that is there's an additional $85 late fee. Any practice after expiration date without an active license does constitute as unlicensed practice. So you could potentially face disciplinary action from the board. And um, so we really encourage everyone to get into the process as soon as possible. And if you have any difficulties, please reach out to us. I will share a number of important links, and I'll also share my email address so you can directly contact me if if there's something major issues that you're facing. Next slide, please. This is the landing page for our health licensing portal. Once you arrive at this page, you can choose to either file for a new application, apply for renewal, reinstatement, reactivation, or CBC where applicable. And our complaint form is also included on our landing page. Links to this will be provided with the supporting materials after the presentation. Next slide, please. So once for users who were previously registered with us, you can use the link that's listed below to log in into the portal. So this is only for individuals who are previously who previously registered or filed an application with us. If you've forgotten your password, there are also items on the left, kind of to help you if you've forgotten your username or if you've forgotten password to help you reset that. If you're still having difficulties, we also have support who should be able to get back to you and help you get back into your account. Next slide, please. If you don't have an account with us, you can use the link below to register with us. It will ask for a few details, and it will also require you to kind of confirm your license number, your date of birth, as well as your email address. So you'll be able to you'll receive a confirmation email allowing you to uh, finish the application form. Next slide, please. Once you log in into the portal, you arrive at this page which summarizes all the licenses or applications that you have with us. You have to hit the renewal button next to the license you want to renew. Some physicians have several license types, so all of them will be listed, and you will have to individually renew the license types that you want to. You can also choose to apply for a new license type on the same page. So this is just, again, the landing portal once you're able to log in. Next slide, please. Some individuals may want to transition they might want to expire their license and transition it to paid inactive. You can also choose that selection on this page, and all you'll have to do is click on the license you want to transition into paid inactive stage. And once you click continue, um, that will officially set you up for that. Next slide, please. So this is the drop down that you get to transition your license to paid inactive. Next slide, please. Most of your applicant information should auto-populate. There may be instances where you have to fill this out if we didn't have it in our database already, or if you started a new application. But we have set the system to pre-populate to cut down the amount of time that it takes you to complete the application. We do ask continue to ask demographic information and languages that you continue to speak aside from English. Next slide, please. Past the demographic information, we do have providers who've switched names or they've had changes in their how their names are listed on documents. So if you haven't already provided that information to us, you have an opportunity to do so at this stage, and of course we'll contact you and update our records accordingly. Next page, please. We do, again, we ask for both a home address and a business address. We have a verification um, uh, checker with the business address to make sure that what you're inputting is consistent with addresses in the district or outside of the district. We don't have the same for the home address, so you can populate it with what you need, and it will update on our end as well. Next slide, please. As mentioned, our screening questions haven't changed. We've just changed the format a little, so you're able to easily upload related documents for each of the screening questions. If you do answer yes to a screening question, one of our licensing specialists will reach out to you to kind of help navigate what documents or other requirements that you need to what supporting documents you need to provide for us to continue with the renewal. Next question. Next slide, please. Our continuing education requirements, as you know, we do require CEs for renewal. You'll be able to select if you've already met that requirement, if you need more time to meet, you can attest to having completed the continuing education requirements by the end of the year or by the end of the renewal period. If you haven't done so, it won't affect your renewal. And there are several options that you can choose. Uh, After renewal is done, we do randomly audit applications and providers to see if they did meet the CE requirements. You can upload your supporting documents immediately, or you can choose to do so at a later date, as long as you meet all your continuing education requirements before the end of the renewal period on December 31st of this year. Next slide, please. Again, registration with the prescription drug monitoring program is required before your application can be renewed. So you can complete it and you can submit it, but will not process it until we've verified that you've registered for the PDMP program. So this may place a hold on your application. So we ask that you do this at the earliest opportunity. Typically, we've asked licensees to register for the PDMP 90 days after a new license. But since you're all renewing, this is a requirement that everyone should have met already. Next slide, please. The next portion is the workforce survey. This helps us kind of identify the needs, the strengths, the gaps in services across the district. We do generate survey results and fact sheets based on what we receive, and the primary care office uses this to identify areas of healthcare shortages and we long term, it's very important in understanding our healthcare landscape and other opportunities for improvement across the district. Next slide, please. As Dr. Anderson mentioned earlier, you are required to attest to the clean hands that you've met all the requirements. And if there are additional documents that you want to furnish us with, you can do so on this page. Next slide, please. So every application or every applicant profession is required to submit a criminal background check before we can issue a license. Uh, at the time of renewal and even if it's an initial license. So what is different instead of the fingerprinting that's done with an initial application, this CBC is name searched. So you do not have to go to Filprint or any other agency. We will run it within the databases on our end. So all you have to do is pay the associated fee, and um, the criminal background check will be taken care of on our end. We ask that you, even if it was something minor, we ask that you provide any information on arrests or any interactions with law enforcement that may show up on a criminal background check. Um, One of the matters that we deal with is always a non-disclosure of events that show up on a criminal background check, and those we typically will require interaction with the board and can slow down your renewal. So we ask that you disclose any significant items that may appear on your background check. If unsure, you're welcome to contact us and we can help you navigate that. Next slide, please. Our system currently accepts only Visa and MasterCard. So once you're done with all the other sections, it will take you to the payment page. As I mentioned, it's $500 for renewal, and then an additional $50 for the CBC or the criminal background check. If, however, you renew after the renewal period ends on December 31st, then there's an additional $85 fee. Next slide, please. So the fees differ depending on your profession. As I mentioned, $500 and then $85 fee for physicians, but for other professions, that looks different as well. Next slide, please. The continuing education requirements haven't changed for physicians. We still need 50 hours of CE. So this can include, must include 2 hours in the subject of LGBTQ cultural competency, 5 hours in a topic designated as a public health priority, and at least one course in the subject of pharmacology. We have not changed our public health priorities, so they remain the same as the last renewal period. And we will share that with you at the end as well. So at least you'll have copies of the expectations for the public health priorities CEs. And again, they differ. The requirements for CEs differ across the different professions, such as physicians assistants and naturopathic physicians as well. Next slide, please.
Actually, Dr. Shitenga, before you move on, can you clarify for the attendees and those that will be listening, the 2 hours of LGBTQ cultural competency, this was a mandate of the council, and sometimes people ask if that is part of the 5 in the public health priority, or is that in addition to the 5 that are mandated from the public health priority list?
So this is in addition to the 5. So out of the 50 hours, Two of them should be in the subject of LGBTQ cultural competency, and then an additional five for the public health priorities. Thank you for that. And again, the expectation is that all the CEs should be completed before, uh, uh, should have been completed between June 1st of 2023 and December 31st of 2024 to be included in this count. Next slide, please. Again, all the professions have different CE requirements, and these are just examples of the requirements for the other professions that we are licensing. Next slide, please. So for the pharmacological course, DC Health does have links and resources that you can use for um, free courses that meet the requirements of this, the course in pharmacological. The pharmacology requirement will include links to all these resources and in the end, so that way you'll have access to all this information. Next slide, please.
I'll just add to that if I may. Those courses that she just listed are excellent. However, if you find any CE that is about, prescribing, about pharmacology, it's helpful if it references that in the title of the course, of the hour course that you did, so that when the staff is auditing or making sure that you've completed your requirement, it's easy to identify that this was a course in medication, new treatments, current treatments, things like that. Make sure it's helpful if it says it in the title, or if you're able to indicate that, this in like the description of the CE, that this covered medication prescribing, so that the staff can know.
Next slide, please. Thank you. Once we have renewed your license, we will send a notification and you'll receive a digital copy of your license. We no longer do physical copies. You can also check the status of your license, or if you want to verify any license type that we have on our webpage. The link is listed there, but it will also be included in the resources after this meeting. Next slide, please. I want to open up the forum for any questions that you may have.
I have a question. If we renew for 500 hours in December, and then 6 months later, we have to renew again another $500 on our birthday?
No, once you renew in December, instead of your license expiring on December 31st, 2026, it will expire on your birth month. Ideally, it's 2 years after, but sometimes, so you may get actually, some individuals may get an additional couple of months on their license, so it won't be 2 years exactly, because let's say you're born in November, right? Or you're born in January, you'll get some additional months on you. And some individuals will have fewer months because their birthday is more than 3 years away from, or is more than 2 years away from when renewals are set. So I'll provide a diagram that kind of helps you identify where your renewal, when your license will expire, but it's all based on, you won't have to renew within the next 6 months or so. So some individuals will get a little more than 2 years, and some individuals will get a little less than 2 years.
Thank you.
But in subsequent renewals, since after we make the transition, it will always be 2 years for everyone. Just this little transition period is what's causing that. think I see another hand up.
Yes, hi. Yeah, this is Ashish Dr. Patel. I was just wondering, so because of the you said a little less than 2 years, a little more than 2 years, will the fee be prorated to reflect that?
The fee will not be prorated, but we're looking at ways to mitigate the impact on our physicians, and we will certainly come back to the group and we'll email blast all our licensees as well for who are affected by this. But at present, the fee will not be prorated.
Hello, Doc. Yeah, thank you for the presentation. Thank you. See you again. We met at the student presentation.
Yes, sir.
It was did a good job. Thank you. The question I have was, of course, you've already talked about this transition, and you said the purpose was to ease the burden. Is that what it is? Because it looked like everybody would be renewing at the same time. So
Right.
maybe that might be a little okay. So this time you will now have it staggered all over according to birth months. Okay, so that makes sense. But for this time, everybody is 31st of December 2024. Is that correct?
So
This period now is December 31st, 2024 for everybody.
for renewing physicians, their licenses expire on December 31st of this year. Whatever licensure expiration date you currently have but once you renew, that's when we'll give you a new renewal date or a new renewal expiration date based on your birth month and then your birth year. So even number expiration date, and then odd number year, odd number expiration date. And that's essentially the major change. Some individuals will get a little more than 2 months because of when their birth day falls, and some individuals will get a little less than 2 years because of when their birth where their birth month it falls.
Okay. Thank you.
It'll be easier in subsequent years, I promise. But it's just yes, we understand it may seem inconvenient now, but as we go on, this will ease the entire process. And I will provide a little table where you can kind of see all this information. I think it's easier when you can visualize it as well.
Okay.
This is how they do it in many other jurisdictions. And exactly as you said, Dr. Ibe, when you can imagine that when all like 12,000 licensed physicians renew in the same month, and some people are really great and they get it in, October 1st, but busy physicians may get it in towards the end of December. This definitely does happen. And it's a big chunk for the staff to have to try to get turned around pretty quickly. So this is hopefully a way that we can spread it out over time and be able to, address the number of renewals more efficiently.
Makes sense. Thank you.
Yes, it's Dr. Patel again. There's a question from the audience about the controlled substance license. They're asking if there's a photo requirement for that license, which I wasn't aware of. And if there is, who do they need to contact to process that?
If you submit your photo with your main application, or if you already have it on file, you don't need to resubmit it for the controlled substance license. We use the photo on the digital copy. So once we send the digital copy of the license, it also has basically we affix the picture you submit to the license. And so if you've already submitted for your renewal or for another application that you're filing with us, you don't need to resubmit it for the controlled substance. If you're having any issues with that, please contact me and we'll get that sorted as soon as possible.
And to clarify, the controlled substance also will renew on your birth month going forward?
Yes, so everything, all licenses, registrations, certifications, anything that we issue to you will now, you'll have an expiration date based on birth year and birth month.
Dr. Shatenga, if you feel comfortable, can you mention anything or include documents at the end if mentioning it now would be difficult, but regarding the new DMV reciprocity agreements or even the interstate medical licensure compact, which some licensees might want to participate in?
Oh, absolutely. So we know that there's a lot of movement of healthcare providers between Maryland, Virginia, and DC. So we are constantly looking for ways to ease the process administratively for the applicant and for us. So since there are a lot of similarities with what we require, what our neighboring jurisdictions require for licenses, we're creating regional reciprocity agreements. So one that we have right now, we have one for physicians as well as for our physician assistants, which just launched on October 1st. So since uh, our requirements are pretty much similar, if you've already submitted some of the documents with our neighboring jurisdictions and they license you, we assume that you've met some of our similar requirements. We may have one or two additional things, but overall, it's a very expedited pathway, and we hope that we can do this with all our license types. Um, as Dr. Anderson mentioned, we don't have a federal or nationwide licensing process, but there are compact interstate medical compact that's helping uh, ease the process for physicians to get licensed in different jurisdictions. So DC is currently a member of that compact. If you can apply to the compact through your state of principal licensure. That's where you either work, live, there are different requirements, and we'll share those with the supporting documents. But as long as you meet the requirements, a letter of qualification is sent out to any jurisdiction that you want to apply to, and you can get your license in as fast as 3 days, or even in some instances, we've licensed individuals after 1 day through the medical compact. We're looking at how we can expand this to different professions across the board, and we will share more information. So for physicians and physicians assistants, we have the reciprocity available, the DMV reciprocity. And then for physicians, we currently have the compact. If you have suggestions on other ways we can ease the process for you, we are very open to hearing you out. You can send us an email to our board medicine website, and we'll be sure to take that into consideration. It's a lot of information, so I will include it in the supporting documents, and you can always reach out as well.
Another question for the audience is, how do you document the CME requirements? Do you?
Could you repeat that, please? Sorry.
For the CME requirements, how do you document, or how do we document that we did 50 hours? The question, I guess, is, do you want the actual certificates for each individual hour, or just like a transcript that says these are the courses I took? I think that's the gist of the question.
Right. Yeah. So you can either upload the certificates themselves, or you can upload um, transcripts from the different boards that offer, professional boards that offer licensing. So again, our application will provide spaces where you can do this, and you can upload it after you've submitted your application. You're also welcome to email it to our Board of Medicine website if you have any issues, or if there's some specific questions that you have on your CEs. But you can upload it directly to whether it's a transcript or the actual certificate itself, whichever is most convenient for you. We want to kind of ease the process for you on your end. In the future, we're looking at working with different brokers, so that way you won't even have to upload anything. It will, if you complete your CEs with a particular, a group, and they'll be able to transfer it directly to our system, so that you don't even have to upload anything. We'll be able to see that, but that's something that we're working on, and it's not yet in effect.
Another question from the audience. Sorry for the noise. Another question for the audience is, do you need to have a DC practice location for a DC controlled substance license?
I don't believe we don't. You don't have to have a DC practice license. We do know that some of our physicians are telehealth, or are involved in telehealth. But if you're facing any issues with the application because of not having a practice location, we can take a look at it on the back end and resolve it. But you don't have to have a practice location in DC for that.
Yeah, I think that's a good point there that needs to be clarified, because I mean, the point that Dr. Patel made, and thank you for clarifying it, but we hopefully help to amplify it across the area. Questions.
Look like there's a hand up.
I have a question. I'm a pathologist, and I'm wondering about CME and photographs being scanned and then put into the document. And then it's possible for you to read individual documents if you have 50 or 70 or 100 or whatever it is.
I'm sorry, could you repeat the question? I may have lost.
I was wondering where you would go to get this done, to get the documents scanned. There are going to be a lot of documents to be scanned, and then how you would read them. I mean, they're inserted into the application, I assume.
Yes, they are linked to the application. So if you already have electronic copies of your documents, I know some brokers are issuing electronic certificates.
Right.
You can simply just email those to us, or forward the documents that you do have, and we'll take care of the rest to link it to your application. You can also directly upload it to your application. Whatever is easiest for you, we'll work with you on it.
Thank you.
And I know some professional societies do kind of collate the CME for you, like mine does, American Academy of Family Physicians. So, and we'll put it all kind of into one transcript and add up the hours and things like that. And so that's an option also.
I would also like to add, we recently sent out an email blast with renewal requirements to all renewal eligible licensees. If you have a license with us and you didn't receive that email, please send us an email with your updated contact details. I want to make sure that you're not missing important announcements from us, or things that will affect your licensure. So please, at your earliest opportunity, email us any changes to your contact details if you have not received the blast that we sent out on a couple of days ago. Any other questions?
Yeah, mine is a comment actually. I use this opportunity to also thank Robert for the work they are doing from the MSDC fund, and because you see, this is one of the member services, member benefits, so to speak. And we get this information, we'll also have to disseminate it amongst the other physicians who may be asking us questions. So I thank Robert and our president, Dr. Patel, for organizing this. And I thank you all for coming to make this presentation. Thank you very much.
I guess one more question. How late in this year can an actual application be sent electronically? Meaning can it be timestamped December 31st of this year, and will that be valid?
Absolutely. We'll take it at 11:59.
And we do get them at 11:59.
And 30 milliseconds.
The people do
And
it.
I think Dr. Ratner has a question.
And will the renewal packets be mailed? And if so, about when? Or it's all going to be done electronically or what?
Yes, we transitioned to fully electronic application system. It tends to be much faster. And for some individuals who don't have holds, they should have already received, as soon as you send us your application and there's nothing that needs further review, you should have already received an approval notice. So that's the good thing about the um, electronic portals and licensing. If you are experiencing any difficulties with our portal, we do have support staff who can kind of help navigate through the system and any glitches that you're facing.
So we have to go to the portal in order to start the process?
Yes, sir.
However, the link should be included in the email blast that went out. So when the licensee looks at that, I believe they're able to click onto, or information on how to get into the portal is included there. But
Yes.
like Dr. Shatenga said, if people didn't get that, either those on the call or those who will be listening to the recording, that could mean that either we have an incorrect email address for you, or there's some glitch. So please contact DC Health if you did not get that email. But if you did, you go ahead and just log on through that email, the information there, and get started.
When should it have arrived?
You should have received it on the 1st of October, and it should have come from a DC Health no reply. My intention is that it will be sent out on a monthly basis, but for individuals who reach out to us and say, hey, I didn't get this, we'll send that to you immediately. Additionally, as part of the supporting materials for this webinar, we'll put that in there as well. So we're trying to make this easy for everybody. We understand what a burden, especially if you hold licenses in different jurisdictions, that can be. And so we are really, really trying to make this as convenient as possible for you. Okay.
I'm just not sure I saw it.
Okay, not a problem. You'll get it again.
Okay.
Yeah.
Great.
Well, this is Dr. Patel again. I'd like to thank Drs. Anderson and Chitenge for the presentation. It's extremely good and very, very helpful. And again, we always appreciate doing this with you every 2 years. It's a great benefit, like Dr. Ebe said, to the MSDC members. And just doctors in DC at large. I know we were supposed to go until 7:30, but sounds like the questions have been winding down. So unless there's any other questions, I think I think we're done.
Okay, I'd like to add one more
Oh, sure.
thing.
Yes. Yeah. Go ahead.
Just a reminder, we are looking for, if you're looking for different opportunities for service to the district, we added a medical reserves corps question that kind of asks if you're interested in volunteering or getting more information about serving the districts during emergencies or planned events. That's included in the application. Secondly, we do have board vacancies for physicians as well as for physician's assistants and other professions. Please do reach out to us. We really want we want you to be involved in the process. We have our board meeting the last Wednesday of every month. We have a public section that starts, open session that starts from 8:30. Would love to hear from you. Our main responsibility is public protection. But part of that is working hand in hand with the healthcare workforce and seeing how we can also better serve you all as well. So please take every opportunity and reach out if you'd want to serve on an advisory committee as well, if you'd want to serve on the board, or if you have expertise that for instance, if you're interested in doing peer reviews and you'd want to share your knowledge with us, we welcome that as well.
I want to
I just had
highlight
to
that
put
as
it.
I want to highlight that as well. We have a innovative and dedicated board, and we would love the expertise that's represented here on this call as well as listening. I just put a number in the chat. There are over 1 million licensed physicians in the United States, and we thank you all for being one of that number, a very important one of that number. And we really hope that these changes that have been introduced will help make your job easier. And we appreciate all of your service to the residents of the district. So we thank you.
Thank you.
Sorry, one last question. For all these, I think it's a great idea to be a member of these boards and service um, committees. But speaking about that, in addition to being a DC licensed physician, do you have to be a DC resident to be on these
So
services?
not necessarily. There's a new regulation put in place that allows non-DC residents to serve on the boards. That gives the mayor, leeway in appointing individuals who are not based in DC or who are not residents of the district. So please still apply. We need all professions.
Yeah, it still is preferred. DC residents still is preferred, but for some areas, there aren't any DC residents that meet the qualifications or have that expertise. So in those situations, in special situations, non-residents are considered. But in general, yes, residents is preferred.
Right. That's for the board, for the advisory committees.
Yeah, that we mentioned.
We're a lot more relaxed, and they help advise us on developing regulations, defining the scope of practice and any other, for instance, peer review matters that come up on the main board. So please reach out.
Thank you very much.
Yes, absolutely. Thank you very much. And unless does Robert have any final words to say?
Just thank you to everyone, and I'll be following up with some written information from the webinar that was already shared and some other stuff to be shared. But thank you all for everything you're doing to make the district a safe place and a better place.
Thank you.
Yep. And see you all November 1st. Good night.
Good night.